Can you remove your own surgical stitches? Have you ever wondered if it is safe to remove your own surgical stitches? Many people find themselves curious about this after a procedure. Let's break down what you need to know about suture removal, immediate postoperative care, and wound care basics. Generally, it is not recommended to remove your own surgical stitches. Stitches, also known as sutures, are used to close wounds or surgical incisions. They requiring careful removal to ensure proper healing and to avoid complications. If stitches are removed too early or improperly, it can lead to issues like infection or improper wound closure. Healthcare professionals are trained to assess whether your wound has healed enough for stitches to be safely removed. They look for signs such as closed wound edges, absence of pain, and no bleeding or fluid discharge before proceeding with removal. Some stitches are absorbable, meaning they dissolve on their own over time and do not requiring removal. Others are nonabsorbable stitches, which must be removed by a healthcare provider once healing is sufficient. If you are considering removing stitches yourself, it is important to first consult your doctor. They can provide guidance on whether it is safe to do so and give you specific instructions. If you do decide to proceed, strict hygiene is essential. This means thoroughly washing your hands and sterilizing any tools you plan to use, such as scissors and tweezers. You also need to carefully clean the area around the stitches to minimize the risk of infection. Even with careful technique, self-removal carries risks. These include infection, pain, scarring, and improper wound healing. If you notice signs of infection, such as redness, swelling, warmth, or pus, or if the wound is not fully healed, you should seek professional care immediately. While it is physically possible to remove your own stitches, it is safest and most effective to have a healthcare professional perform this task. This ensures proper wound healing and reduces the chances of complications. If self-removal is necessary, it must be done with extreme caution, under medical guidance, and with strict attention to cleanliness and wound care.